Thank you, Chairman. Good afternoon. I'm Dr. Hongjuan Wang from Taiwan, Kaohsiung. I have nothing to disclose. Since 2008, low-energy shockwave have been used to treat chronic prostatitis with promising results. However, until now, we didn't know what happened inside the bladder. So we hypothesized that the low-energy shockwave can suppress inflammation molecules and reduce the inflammation, reduce pain in non-bacterial prostatitis model. We inject the capsaicin into the SD rats right after and 24 hours after the injection. Different numbers of shockwave was at 0.12 millijoule was applied direct into the prostate. To assess pain, we use the nociceptive behavior change and use the von Frey filaments to test the pain ratio. All the results in the figure will be shown in this order, vehicle, capsaicin, and shockwave. Okay, we can see the capsaicin really lower the pain ratio. This is the lowest one. And the shockwave with 200, especially the 201, improve the pain ratio, almost identical to the sham control. And the PMN positive cell and COS2 positive cell induced by the capsaicin was mediated by the shockwave, especially in the 200 and 300 shock group. The same result was found at 7 days. For Western blot, we can see the capsaicin induced the inflammatory cytokine expression, include the COS2, and these cytokines the expression was reduced by the shockwave, include the COS2, capsaicin-1, interleukin-1, 6, and NGF. And the effect was more obvious in 200 and 300 groups. We can see the same result in 7-day group. Except for the TNF-alpha and NALP1 expression show the difference. So our conclusion is low energy shock wave did inhibit the capsaicin-induced inflammatory molecular expression and inhibits the inflammation and the pain in a dose-dependent fashion. Thank you.
Thank you. Thank you very much. Any questions from the audience? Dr. Kanai?
Tony Kanai from the University of Pittsburgh. That's a nice study. But, you know, in prostatitis, with time, you get a periurethral fibrosis and some effects. Do you think you would have any therapeutic benefit after you had more severe fibrosis?
Actually, in our study, we try to have some trichome stent. We didn't show that. And the fibrosis, the collagen deposition is lower in the shockwave group. I think there's some difference. But with time going, I think different time point will show the different result. Yes.
So I am a little concerned that, to me, this is a acute inflammatory model.
Yeah.
And what we used to call chronic prostatitis and chronic pelvic pain syndrome, the NIH studies showed there's no difference in inflammation in the prostatic secretions or urine between men with chronic pelvic pain and controls. So it's a stable, non-inflammatory state, and this is an acute inflammatory model. So I'm wondering how relevant it is to the patients that we see in our office.
Yes, I know the model is not perfect to test the chronic condition. However, as we know, probably the chronic prostatitis or the prostate pain is a neurogenic condition. I think we observe the shockwave can reduce the pain, but currently we can tell which pathway or what really happened So that's what we are working on right now.
Okay. Other comments or questions? Thank you very much. Appreciate you coming to presenting your work.